Go ahead, Reva. Thank you.
Good afternoon, Chair Senator Warner, Vice Chair, and members of the committee. She Reva Stewart, she. Nashasha Shlump. Oh, sorry. Nashasha Shlump, Batani, Bashishtin, Gayani, Dashacheto, Haglini, Dashnal. My name is Reva Stewart. I am here on behalf of the Turtle Island Women Warriors, a grassroots organization dedicated to protecting and advocating for our Indigenous peoples and families impacted by the systemic abuse, fraud, and neglect of Ahcccs and Ahcccs under the American Indian Health Plan. I've been advocating since this started. I've had family members that were affected by this. For years, our organization has documented and reported fraudulent activities in treatment facilities that targeted vulnerable Native American communities. We also do direct outreach and advocacy for our Native relatives harmed by the scheme, connecting families to resources, locating missing loved ones, standing with survivors who were promised healing but instead exploited and staying with the deceased until family is notified. To date, Turtle Island Women Warriors has received and submitted over 1,000 complaints from the public to the Federal Office of an Inspector General, the OIG, since 2022. We've only received acknowledgement emails from OIG and FBI confirming the reports that were received since March of 2024. Yet, prior to that date, no acknowledgement. We've collected and archived 7 banker boxes of documentation on fraud, abuse, and trafficking. Purchased hundreds of bus tickets, plane tickets, spending over $30,000 of our own funds to help relatives get safely back home, as far as Alaska, Montana, Wisconsin, Texas, thousands. To date, we've distributed more than 1,172 hygiene care packages, 1,172 hydration packets to relatives abandoned or stranded by these schemes in the last 2 months of August and September of 2025. We've distributed more than 8,323 bottles of water, both in August and September of 2025. Distributed 200 care packages 3 times a week in 2022, 2023, when the facilities were rampantly shutting down. We've conducted outreach in 15 parks and 75 to 100 different street addresses where many of our relatives were dropped off and left behind. We've provided over 1,200 doses of Narcan and 12,000 first aid interventions directly on the streets. We've spoken with families and parents desperately searching for their missing children or family members. We've been notified of over 1,000 deaths connected to this fraudulent system since 2019 and still counting. We've helped over 5,000 relatives return safely to their families since 2022. We hung up over 400 missing person posters in effort to locate our relatives. We have reported hundreds of traffickers and recruiters directly tied to these fraudulent facilities. We have conducted outreach 72 times a year so far this year, 288 times last year, 400 times the year before. But despite this enormous effort, we've had to stop reporting to the OIG since March of 2025. Why? Because our reports and evidence are being handed back directly or indirectly to the facilities and bad actors we are exposing. This endangers not only us, but also the survivors and families who trusted us with their stories. Through our outreach, we have witnessed heartbreaking realities which were mentioned by the OIG Vanessa Templeton as her witness statements in August 18, 2025. But we have reported documentation sent in 2023 to the OIG reporting that exact report, detailing what happened to our Native relative. A young man who escaped through the backyard to seek help from one of our volunteers to bring him to our team to get him home via Greyhound bus, and with the mention of being locked from the outside in the home. A young mother taken hundreds of miles from her home, promised care, but left on the streets with no treatment, no support, no way home. Relatives who entered programs seeking recovery only to be cycled through multiple facilities for billing purposes under Ahcccs and ADHS, treated as numbers, not human beings. Families calling us in desperation, not knowing where their loved ones are or even if they're safe. These are not isolated incidents. These are widespread and continue today as we speak. But today, I must tell you something I never thought I'd say publicly. Turtle Island Women Warriors has stopped filing reports to the Federal Office of Inspector General and other agencies. Because our reports and evidence are being handed back to the very facilities. This is not speculation. We've seen retaliation and intimidation increase immediately after reports were filed. We cannot continue to put our volunteers and survivors we serve at risk by feeding information back to the traffickers and fraudulent operators. This is unacceptable. It undermines every legitimate investigation, endangers grassroots organizations, and perpetuates harm to our Native communities. We are asking this community to take immediate action. Specifically, we urge you to formally request that the OIG Inspector General immediately cease handing over private citizens and organizational reports to the facilities and individuals under investigation. We also ask you to mandate strict confidentiality protection. Establish penalties for any agency or facilities that retaliates or compromises the confidentiality of reports. Create a secure, independent reporting mechanism so that organizations like ours can submit evidence without fear that it will be leaked back to the perpetrators. We will continue to support and advocate for our Native families who are victims of these fraudulent schemes, but we cannot and will not put our community in further danger by reporting into a system that leaks to traffickers. We need you as elected leaders to act now, protect people who are coming forward, protect the grassroots organizations, protect the victims. Thank you for your time and your commitment to justice, and we welcome your questions, and we are ready to work on solutions.
Thank you, Reva. Excuse me, thank you.
Madam Chair.
Yes, members, any questions?
Yeah, Madam Chair. Oh, thank you.
Gabaldon?
Thank you, Madam Chair. Ms. Stewart, thank you very much for being here today. I appreciate that. But clarification in regards, on the beginning of your statement, you had indicated that there was over 1,000 complaints. Can you clarify who you were complaining to?
We reported to the OIG, to the FBI directly, emailed them directly. We didn't get confirmation until March of 2024. Prior to that, I was emailing them every single report that I got. So I do have confirmation on every single paper that I have sent in, hence the 7 boxes.
Thank you. Madam Chair,
Yes.
Ms. Stewart, thank you very much for being here today. This is just alarming what you just testified on, and yes, I appreciate you being here, and I'm so sorry for all your problems.
I do have paperwork to show. Let's see, I made some for everybody here to show what I was talking about of our reports being handed back to the facilities.
Thank you, Madam Chair.
Thank you. Senator Gonzalez.
Thank you.
Madam Chair and Mrs. Stewart. Ms. Stewart, also thank you for being here and to testify. It is alarming. Madam Chair, I'd like to, for the committee to follow up more on these filings and who, what happened, and I would maybe suggest that you report to us, that you individually if you want to, or to the chair, and that we start looking at these reports and filings of yours more intently and with care, and be responsive to these reports. That and advice, Madam Chair, I'd also like to follow up with the statement of them being not being kept confidential and sent back to the perpetrators, and then their being some retaliation on those. Really, we need to follow up on that, so I thank you.
You're welcome.
Thank you, Reva. Senator
Madam Chair.
Angus?
Thank you. Early in your statement, you said that you've been doing this from the beginning. What year would that be?
I believe I started in 2021 when it first was reported that the white vans were being out on the reservation. And where I was working at that time, which is across from the Phoenix Indian Medical Center, there was just a caravan of white vans. So I started taking pictures. Don't get me wrong, I don't know why, but I did. And it wasn't until my cousin was taken. She was brought down here from Farmington, New Mexico. And she went missing, and we were able to find her within 3 days because she refused to give her information to these homes. She refused. Had she not refused, I would have never probably figured this out. But once I figured out that they wanted her information under the American Indian Health Plan, I then put it on social media, and it snowballed from there.
Okay, Madam Chair, I have a follow-up. So you said you've been doing it from the beginning and all these terrible things that were going on, but you said it still goes on today.
Correct.
At the same numbers, have you noticed any decline since we've been talking about it and we've been hearing that the problem's been taken care of?
Absolutely not. We see recruiting, when we do outreach, we do continuous outreach. When we go out to the parks, I mean, you see a lot of our Native relatives that are now homeless because of this scheme, how they were just dumped after all the, after Ahcccs and ADHS shut them down. It was rampant. It was really rampant. There's still quite a few out there. They're just being shuffled into these homes under the marketplace plans. You can see recruiters out there at the park actively recruiting. So it's still happening today. I'm still having people who have died as we were doing outreach. We've been there. We've waited for families, the medical examiner. To this day, we are still doing it.
Madam Chair?
You may.
Just one more. Thank you so much. Can you please repeat the name of your organization? I couldn't.
Turtle Island Women Warriors.
Turtle Island Women Warriors. Thank you so much. I'm sure we'll be talking to you again.
Thank
you, Madam Chair.
Ms. Stewart, you said you had banker boxes with the complaints?
I have 7 banker boxes. My first box, I had taken it to anyone who would listen. I carried this box with me. I went to health committee meetings. I went to just anyone who would listen, carrying my box. I have this box. Anybody want it, has information. This is what's going on. And no one took it. I still have it. Okay. And so now I'm on 7 boxes of banker boxes because I write everything down and I report it. I have a form that we report to the OIG, to the FBI, and we write everything on there. So yes, I have 7 boxes.
Would you be open to bringing those to my office?
Yes.
Thank you. Okay. We'll get your information. Thank you.